Okay, I am not even sure that we will be taking the whole 55 minutes that are left, because I am not a person who says we have to stay here just to stay here, and I'm also catering to Bernie's conflict of interest that he has to get on an airplane. So we'll be out certainly in time and maybe sooner. Genetic Alliance has a saying that if the discretionary time fairy can give you back time, that's a real gift, because all of us could use time more than money these days, I think. So some of the sort of buzz in the room and on the webcast, I think, are, so what? You know, so we spent another day talking about conflict of interest. Where did this get us? And this is what this last panel is designed to do. So all of you are going to solve this issue. I'm going to begin by saying I think what we do want to do in this last session, and then there's supposed to be some time left for me to make concluding remarks, but I give you the warning that this is actually part of that ending. I think what we have heard throughout the day has not been the same old in some ways. I think we've also heard from feedback informally from all of you in the webcast that we have moved, and that there's not a divisiveness or division the way there may have been before, and there is some consensus around what are the issues. Adam and I were talking, and I think one of the things that's really striking to us is that a lot of the issues can be traced back to a lack of alignment of incentives. When we work on the roundtable in general, a lot of the problems of innovation can be traced back to a lack of alignment of incentives, which completely aligns with what the panel before us said, and that was some of you, around make it simple, because we're drowning in simple. Find ways to reward. Those are all incentive kinds of issues. So I think what I'd like us to do in this last panel is, number one, we do want to leave the day with some things that we can use across the community that work. Someone remarked during the break about something completely different, but it's really aligned, and that is in pediatric oncology, there doesn't seem to be a problem the way there is in some other areas, and we know that that's because the incentives are very much aligned. In Margaret's words, the patient's right there in front of you. Who can deny sick kids? And it's required. You know, there are leadership that's made decisions around making sure that everybody collaborates, share data, put every child in a clinical trial, et cetera. We don't do that with adults. So I think my question to each of you, and I certainly also very much invite the participants here to join in, is if that's the major problem, if we are too complex, and if we're not saying it simply, and if we're not keeping the patient at the center, we're not aligning incentives, I think those are all related to each other, then what have we learned today, and or what do we still need to do? Like, what's the to-do, not the talking, the to-do from today that we need to move forward from here? And Margaret, we'll just begin with you and go